Hi, Dave from Ryan Hills Physiotherapy. Yesterday I posted a little bit of information on Facebook about the anatomy of a joint, hopefully so we can have a bit of a chat about osteoarthritis this week. So today I thought I'd just take the chance just to have a look at what's actually going on in a joint when people, or if you do suffer from OA, osteoarthritis. I think the other thing I'd like to say before we even start is that there is a lot that you can do for osteoarthritic symptoms that don't require surgery, and there has been some fantastic studies done recently showing the effect of exercise with especially osteoarthritic knees and hips. And we'll have a chat later on this week about the benefits of exercise. But anyway, on to the sciencey bit. So, osteoarthritis, if I try and limit this to a few points. So, what's going on? Look, the big thing that we're always talking about with osteoarthritis is that the cartilage covering of the joint, just in here, which is, I always think of it as like a bit of a smooth snooker ball, that it becomes a lot more roughened, it becomes more irregular, and it doesn't allow for that nice smooth movement. But that's probably a consequence of a lot of other factors that are going on. So one factor that will happen is that the bone that sits above the cartilage, your subchondral bone, in real life that's supposed to have a little bit of bend, sort of slight flexibility, and it acts as a shock absorber, and it also helps with the nutrition of the cartilage to keep that cartilage nice and healthy. In an osteoarthritic sort of situation, we tend to find that this bone gets an awful lot stiffer, it gets harder, so it loses its shock absorbency, and it loses the ability, or affects the ability of nutrition into that cartilage. So that's one point in why we get osteoarthritis. Another point, on the internal lining of the capsule and the ligaments, we find we've got a structure called the synovium. It's like a thin skin. The synovium will produce fluid that creates lubrication that allows for the smooth movement of the joint. Now, in early stage osteoarthritis or an injury, this synovium can become irritated, it can become quite thickened, and it'll create an inflammatory environment. And that inflammatory environment then affects what's going on at the surface of the cartilage, and that can cause it to degrade, it can cause it to start to break down. But in good news, we have the ability within ourselves to offset that inflammatory environment, and that comes down to exercise. What else do we know about osteoarthritis? Basically, another one is the muscles surrounding the joint. The muscles don't only move the joint, so especially the knee, it's not only about bending and straightening the knee, but the muscles act as, here's this word again, a shock absorber. So they attenuate, or they sort of absorb the forces going through that structure, and they help to protect the cartilage, so the cartilage is taking its appropriate amount of force. When the muscles become weaker and become smaller, a couple of things will happen. A, we don't have as good shock absorbers. B, our ability or our stability of our joint, our movement patterns at our joint are slightly altered, so the patterns of wear and tear will change, and it will go onto parts of the joint that don't tolerate it as well. And that probably creates an environment where these surfaces can then start to degrade or become a bit more degenerative. However, we can always get the muscle stronger, we can always get our balance better, and we can always improve our movement. And by doing that, that'll reduce the loading, it'll improve the shock absorption, and it has the added bonus of producing chemicals that will offset this nasty inflammatory condition. Another thing that's very, very important with osteoarthritis, and especially when we're looking at knees and hips, is body weight. Now, the interesting thing that we find with body weight is that with a 5 kilo loss in body weight, we can reduce the amount of force going through that knee by anywhere between, I think it's somewhere between 10 to 15 or even 20 kilograms per step. So that's a huge reduction in force going through that joint that's getting compromised. And also, by altering our body weight, by losing weight, what that will do is that chemical environment in there, that becomes much more anti-inflammatory as opposed to pro-inflammatory, thereby decreasing the pain and also helping to preserve that nice cartilage that we've got in there. So that's trying to keep osteoarthritis as simple as I possibly can. I hope that's been of use to you. The big messages I want to take away from this is osteoarthritis can be asymptomatic. You can function very, very well and actually perfectly normal with degrees of osteoarthritis in your joints. Exercise, body weight seem to be the major things that we can do ourselves that can make a huge difference. Anyway, we'll produce a few more posts this week. We'll chat about knees, do a bit of an interesting little look at an osteoarthritic knee and how it moves. And we'll throw up some more tidbits. Have a nice week, and I'll speak to you later. Bye-bye.